of the third day of Brain Awareness Week 2020. This is conducted by Gujarat Forensic Science University and organized by Dana Foundation and IBRO. I am Anne Paul, pursuing Masters in Neuropsychology from Gujarat Forensic Science University and the moderator of today's session titled Effect of Drug and Alcohol, the Brain and Associated Behavior. And this will be conducted by Ms. Smaranika Tripathy. We are so glad to have you here, ma'am. She is a clinical and rehabilitation psychologist and has been practicing since last 14 years in this field of mental health for testing patients with depression, anxiety, and various other mental disorders. Her areas of specialization are counseling, psychometric assessments, and therapies for various psychological disorders and other concerns. So I hope you're all set to hear from ma'am. And you might all be familiar with the effects of drugs and alcohol on the physiological, that is, the organ system. So let's find out about its effects on the brain and the associated behavior. So, ma'am, you can take over.
Thank you so much, Anne, and very good evening and a good afternoon to everyone who's here present with us for this session. When I was approached to speak about something which is related to brain, I thought that the most important part in the new area of development and lifestyle which we are following nowadays, alcohol and drug probably has played very important role. Why I'm saying that it has become a very prominent or a part of our lifestyle now, because uh, there are different categories of people who assume and who take alcohol or many kind of drugs, thinking that this is going to strengthen them otherwise. I would like to start with a small incident. In my clinics, I have been seeing a lot of teenagers and adolescents when they come to me with issues of psychological disorders like depressions, being very um, violent, very rigid, having sleepless nights, not being able to focus or having concentration difficulties. And when I go back to their history, what I see and hear from them is that they actually adopt alcohol and drugs as a part of their life. They think that they strengthen. So the basic idea here is to make people understand that there are certain or a larger amount of myth which is connected with the use and abuse of alcohol and drugs and how it affects our brain. So I would like to, take you all to the slides which I've uploaded. I'm sure it is going to help you out to understand what basically I'm going to focus here. Uh, um, Give me 1 second. Yes. So I think it should be visible to all. Yeah. Um, my introduction has already been given, so I would start with the topic. Uh, as we all know, we are going to talk about the effect of alcohol and drugs in our brain.
I think it's your laptop.
And
Is it? Yeah, वहाँ पर कुछ नहीं हो रहा.
and
यहाँ lag है. No,
now
don't reload.
brain function.
This is the host. Don't.
So
सब
I
कुछ stop हो जाएगा. देखो
so
यहाँ
I think,
lag है. ये ठीक चल रहा है.
the first one,
Because it's probably because कुछ चल रहा है पीछे.
and I think I'm hearing your voice also. So the topics or the kind of pointers I'm going to follow or focus today are the various functions of brain. Let us first understand why we talk about brain and what brain does for us. I'm sure all of us have our cell phones, right? We all carry our cell phones 24 hours with us, and We feel that we are connected because of our cell phone, right? Uh, Brain is another name for cell phones, I guess, because it helps you connect with the outer world. That means it helps you get information from the environment, understand and process it, and proceed further. So you can understand it is brain plays the major part of what we do, how we think, what we perform, the way we talk, our body language, our emotions, our thought process. So imagine if there is something which comes as a external substance on top of it, obviously it is going to have some kind of impact. For a simplest example, when you start eating and overeating, what happens? It automatically affects your body weight. It automatically affects your BMIs. Similarly, alcohol or drug, being an external substance, it affects the way brain functions. Definitely does not function the way it should. So with the help of this presentation today, we would understand how slowly and silently these substances can actually affect not only your physical system or your physiological system, it also majorly affects your psychological system, and which gets visible not only to you, to your family members, but your peer group. So you can understand one thing can affect the existence of a person altogether. So we'll focus on how the brain functions, how do substance work in the brain, the effect on the brain, the long term and the short term effects, and the behaviors. When it comes to the behavior, I think all of us have seen when somebody is drunk. How do we get to know that that person is drunk or that person is high on alcohol or drug? Because they, most of the time, they fail to communicate properly. They fail to understand the commands and reciprocate accordingly. Uh, Sometimes they have difficulty in walking. And if I actually go to the physiological setup, most of them are patients of diabetes, hypertension, blood pressure, and many more. So let us first go to the, understand what brain is all about. So if you can see in the slide, uh, I have tried putting across a picture, and this is actually a choice we have to make. What kind of a brain we all are looking for. So if you see, if you can enlarge in your own screens, uh, the way our brain works, if it is a healthy brain, it is functioning beautifully. But with some kind of a substance abuse, whether it is alcohol or it is smoking or it is cocaine or it is any kind of it is marijuana, anything, any kind of drug can affect your brain in such a way that it not only shrinks in shape, it also starts malfunctioning. Now, most of the time, I also get to hear people say that, how do you actually know that it is alcohol which is making a difference? Because I absolutely feel better next day. That's the irony here. Alcohol or drug also has a capacity to show or create that impact in a very slower manner. Initially, you would not feel it, but gradually it starts affecting your overall immune system, overall physiological system, and for which most of the time people get admitted in the clinics. Let's go to the other slide. Okay, how the brain functions. So, as I said, the first one, the way our brain functions is communication. Now, what kind of a communication? I'm sure most of us know. It is basically the signal through the neurotransmitters brain takes, and then it gives you away. So, if there is something, if there is a noise, if there is a vehicle passing by, it is the neurotransmitter which sends the message to the brain that there is a vehicle coming by. And it is the brain which processes it to understand, yes, there is a sound, if this sound is familiar or not. If this sound is familiar, then what vehicle is that? It starts, again transmitting the process or the message further to understand how to go about, whether we are supposed to stop or take a corner of a road, or to wait, or to find out the vehicle. Similarly, it also responsible for all the bodily movements. A simplest example could be a minimum kind of a reflex is also regulated by brain functions only. When your name is called for, suddenly somebody calls Smaranika, and I nodding my head or looking back also is a sign that the message has gone. The neurotransmitters have done their work, and they have told, or they have processed the information that my name has been called. So if I have to explain, or if I have to simplify it, I would say recognizing each and every stimulus in the environment is actually done by the functions of brain. So if you are hearing a voice of a fan, a voice of a person, if you are hearing a ring of a bell or a telephone, if you are seeing a message on your TV screen, it is all happening because of your brain. So the major function here brain plays is communicating, not only through the neurotransmitters, not only to the sense organs, but also to your body, so that the body moves accordingly. Now coming back to the next and most important point. We all have emotions, aren't we? Some people laugh, some people cry. Many people, they have tears all the time. So how do we get these emotions, and how do we feel these emotions? Brain is another, the role of brain for regulating emotions and psychological well-being is very important here. So most of the psychological therapy is also based on the cognitive approach, because brain helps in the overall cognition of human behavior. When you are getting angry, that is also regulated by brain. When you are tearful, or you're crying or feeling sad, that is also regulated by our brain. So you can understand how important, when it one side it controls your physiological movement, your understanding of the stimulus. On the other hand, it helps you respond to it appropriately. Suppose you see somebody very sad, or somebody is in grief, or somebody is crying. It is the brain which makes you understand the emotion well and respond to it correctly. If I have to ask you, how many of us responds to laughter when we see somebody respond by laughing when we see somebody crying? Automatically, there is a feeling of empathy. Automatically, there is a feeling of sadness. So, it helps reciprocating to the emotions appropriately and accurately. So, thoughts, feelings, and actions. If you have, feeling of love for somebody, that is your brain which is helping you. So, I think here we can contradict by saying that, feeling of love is not correlated to the brains. No, it is not that. Every emotion, the way we behave or the way we think, whether we like something, do not like something, or dislike something, or we want to have something, or we do not want to have something, it is all regulated by the various functions of brain. Now I would slightly touch the role of, or what is substance, what is an external substance, what is alcohol, what is drug, what it is. In a very simpler version, I would say these are certain external substances which alters the way we function, both physiologically and psychologically, which means this can either excite you to a level so you feel the feeling of pleasure, and it can also slow you down. So you may have difficulty in judgment, you may have difficulty in understanding, you may have difficulty in focusing at certain period of time. There are chances or there are instances when the use of substance, drug or alcohol also affects the way we eat or sleep as well. So, in the next slide, let us focus what happens. Let us understand how it affects it otherwise. So, the point one says it goes straight to your head. What does that mean? That means when we talk about the function of head, let's take out the internal part. When we talk about the function of head, we say from here we think, from here we memorize. So it helps in intelligence. So it goes straight to your head, which means it affects the way you coordinate think, the way your judgments are done, or the way create a balance. So which means suppose if you have to drive back home after taking drug or alcohol, it becomes very dangerous because it hampers your ability to judge correctly. It hampers your balance. It can be your motor coordination, your gross motor coordination, or fine motor coordination. So for an example, most of us in movies or during some parties or some occasions, we must have seen people lose their balance to walk when they are on a higher dose of alcohol or drug. There are multiple accidents. I mean, I think the rate of accidents over alcohol or over addiction to drug or any other substance abuse have got almost 33% of rise in the rate of accidents every day, which happens in our country. So no wonder nowadays, in our country, there is a strict rule, or there's a lot of checking, or there's a lot of strictness which has been maintained, because drinking and driving becomes very, very difficult and dangerous because it affects straight to your brain. Now coming to the other part of it, why it says that your brain shrinks. What happens? Suppose let's take a very simple example. This is the part of our brain. Okay, the middle part is something which is full of this is the cerebral cortex, the medulla, the thalamus, the hypothalamus, and everything. Okay. Now what I will do from this side, I'll try to push it from a outer external substance, and from both sides I'm going to push it. What will happen? This is going to shrink. If it is going to shrink, then what will happen? The way it will function, it will not function. Suppose with a capacity of 4 people in a car, you put 8 of them together. What happens then? There is a feeling of suffocation. There is a feeling of insufficiency. People do not feel easy. They want to get out of that. They don't want to be there. So, drug and alcohol has that capacity which can shrink your brain in such a way that your ability to think, learn, and also concentrate or focus gets affected. So you'd see most of the teenager or adolescents, when they enter college, they have a perception that there are many drugs which helps in attending to things better, so they start taking it. No, absolutely no. I'm sorry to say it does not affect. Rather, the more you take, other than becoming more focused towards your academic ability, we lose control over that. And your habit becomes addiction slowly, and you become so dependent that you forget about your academic ability. You are totally into taking it and how to use it and how to go about it. So in a general platform, whenever we come across a case, because let me tell you that most of the cases where there is a there is a substance abuse, whether it is through drug or alcohol, we are absolutely in denial. So it is very difficult to know um, what happens to your patient. So sometimes what we do a mini mental status just to know whether this person has been into addiction or had been into some kind of a dependency or not. And the best way to understand is that the ability to think, concentrate, and remember. Now, coming back to the alteration of the neurotransmitters. As I said, what it does, it excites the level of, it increases the effects of neurotransmitters called GABA in such a way that you feel little sluggish in your movement. At the same time, it enhances the secretion of dopamine. And how is dopamine, the hormone dopamine is related to the feeling of pleasure. So people, when they feel good, or when as a part of antidepressant, many a times, these kind of drugs are introduced so that the secretion of dopamine increases, which increases the feeling of pleasure. But unfortunately, alcohol definitely increases the feeling of pleasure, but it does not last for long. So initially you feel good. So you must have seen people, they really enjoy drinking. Once they are into, drink, or they are into drugs, they feel very good about it. And that could be one of the reasons. The nature of these substances are so high that people tend to get into it because they associate pleasure with these substances. They feel that the moment I take it, I may feel very pleasurable, I may feel very good, so I should be doing it. Now getting back to the effects on cerebral cortex. So how is cerebral cortex related to us? I mean, what is the function of a cerebral cortex? It helps in being conscious, right? It makes you understand who's your dad, who's your mom, what is letter alphabet A, what is alphabet B, recognizing. So it makes you very conscious, aware of what is happening, what is not happening. It helps you with your eye-hand coordination, where to point out, where is the plug, where is the switch, how to drive a vehicle. So it is a very, very transparent and a straight affair. However, the task is a very difficult one. But due to the effect or the adverse effect of alcohol and drug, it affects our consciousness, which means if you are able to recognize, or if you were good at remembering things, if you were good at solving a puzzle quickly, you will not be able to do that. Now, many a times it happens that people say that, no, I drink, but it never affects me. I have never seen something like that. So what happens? Again, as I said, the process goes very slow. On a long run, these are the things which becomes more visible, and it affects your senses, the way you consciously do things. Now, going back to cerebrum again, the role of cerebrum is regulating the movements. So left, right, left, left, right, left. That is what cerebrum does for us. But if you are into some kind of an addiction, your left becomes right and your right becomes left. Why I'm trying to make it more into the behavioral pattern? Because these are the things which are visible. What happens inside your brain is a long-term effect, which I will go slowly. But these are certain things which is immediately visible. You get to see this is what is happening. Now, the most important part. I think let me take the effects of medulla first, and then I think I will go to the effects of, it affects hypothalamus and pituitary. How? So medulla again, in a very simpler form, it helps us being conscious. So you would see people getting frequent blackouts. It is only because alcohol or any drug has an adverse effect on the functioning of medulla. So they get these blackouts and they become forgetful as well. They do not remember. Now the final one and the most important one. Since I'm a psychologist, I see most of the cases with marital issues or marital discords. They come to me with a problem, with a very sensitive problem of sexual imbalances, sexual, dysfunctions, or husband or wife or both the partners unable to satisfy each other. What happens here? The when you start getting into a dependency, this substance has a very strong element of affecting your hypothalamus and pituitary gland, which are basically your related to your sex hormones. So your capacity to perform, or the capacity, so initially it may give you an urge to do it. So it may give you an excitability, but the capacity to perform reduces day by day. So alcohol starts, affecting your sexual life and your relationship in a very, very adverse manner. So I think that is something which we see being psychologists in relationship issues. Most of the cases they come to us with these kind of, problems, and we just advise them, stop taking alcohol, please, because this may actually ruin your family balance. Let us quickly go to certain short-term effects. As I said, disinhibition, very non-typical behaviors. Some people, they talk a lot. Some people, they become aggressive. They start throwing up. Yes, mood swings. Very peculiar, but very interesting as well. Because the short-term, effect, you would see a person suddenly getting very emotional, very sensitive, and starts crying, regretting of the past, approaching people, apologizing to them, starts talking about what happened in the past. I have seen cases where, after a certain period of time, they spoke about the childhood and how they must have hurt their teacher or their last boyfriend. So there is a lot of mood swings. Suddenly, a person becoming very aggressive. Yes, I think this is one which is mostly visible in cases of dependency, because your mood fluctuates suddenly. Somebody who's a very sober person, very down to earth and non communicating person becomes very aggressive. They start getting irritated soon. They start focusing less. They have difficulty in sleep. They have trouble with their motor coordination. They're unable to hold a glass properly, or sometimes their handwriting, when they're writing, it starts buffering. So it may happen. Hangover after binges, we all know, we have bad headache, vomiting, feeling of uneasiness. Why it happens? Because any kind of a substance which is abused actually makes you dehydrated. So the level of water content reduces, and your body wants to come out of it. As a reaction to that imbalance in your physiology, you start throwing up and you get headache. So, you understand that these are certain things which we call as hangover, but it's not that. It is basically your body is dehydrated and it wants to be filled with water. It is trying to manage that external substance which has been taken, and which has been taken for a long duration or rapidly every day. Memory lapses, blackouts, I already told. Here there are types of memory lapses which we see. I forgot, people forget what happened last night, or people usually forget things. They become more forgetful. Now going back to the long-term effects, we all know paranoia, hallucinations, depression. Yes. Now, depression, anxiety are two things which are correlated with substance abuse, hand in hand. In the sense, it has a very negative correlation, where, because people think when I'm very anxious or depressed, I'm supposed to take a drug or alcohol, and vice versa. So it is basically it is the substance which is taken which may make you feel miserable. It may lead to depression, it may lead to anxiety, because as I said, it affects your major part of your brain, how you function, what your emotions are, how you react or respond to various emotions, what you recollect and what you do not recollect. Neurological conditions like mental confusion, we have seen cases of dementia. um, you know there are paralysis as well, nerve paralysis, so you are totally like a vegetable. There is your ability to think and ability to produce gets affected very adversely, so it becomes difficult that way. Donia incapacitating dementia. So these are certain long-term long-term effects. Uh, though I must say, with time these happens, because hallucination is something which does not happen all of a sudden. But yes, with due course of time, mm, people start hallucinating. They start hearing voices, or they start seeing somebody. So there could be auditory hallucination, there could be visual hallucination, there could be hallucination in perception as well. So these are certain long-term effects of drug and alcohol. Uh, yes, I think here I must highlight about over drinking or alcohol abuse disorder, or maybe people who are regular into drinking, because most of them, they ask me that I'm not a regular drinker, so I don't think I'm into dependency. I don't drink every day, so when I drink it is very less in quantity. Oh, no, no, I drink just once a week, but the quantity is more. Let me, it is very important to clarify here is that it's not about how often you are drinking or how many pegs you are drinking every day or the amount you are drinking, or you are trying to balance out a substitute, or you are drinking 3 days. Doesn't matter. What matters is how it is affecting. So you have to check. How do you check that I'm into dependency? Is that you start, people with dependency, they start finding out reasons to celebrate, and they drink. They associate their winning or failures or success or failures with substance abuse, so they get into it. They become very defensive. They say no, no, but there is a yes, yes. They start planning whenever they are in a group. They start planning about you know what to drink, what to start, what to do, this and that, blah, 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 blah. So these are certain very important signs which we must understand. They become very restless if denied for. There is a huge behavioral changes when it comes to substance abuse, because there is a denial and there is a tolerance as well. So, unless until you feel it, unless until you get that buzz, you cannot refrain from there. And eventually what happens is that when you start with some kind of an addiction, first time, second time, third time, I think smaller quantities gives you that feeling of pleasure and you're happy about it. After some time, your body becomes both your mind becomes tolerant, and you only like the condition or the stage of pleasure, so you want to go to that stage regularly and often. So in that case, instead of uh, making it 3, you start taking it 4, 5, because your body is already tolerant to 3. So even if you take 3, it doesn't help you. So you ask for more, unless until you get that buzz. So this is how the curve, goes up, and finally you understand that it is not about the quantity or the frequency or the situation. It is basically the way you want to have it, or the way you want to feel. Now, talking about use of drug and alcohol, as I said, lack of awareness, believing in the um, faulty informations, or believing in the myths. Sometimes we fall into this. Now, in a very general and a very simpler for society, our lifestyle. There is a huge change in the overall lifestyle pattern of human beings nowadays in the 21st century, and alcohol has become a part of us. Or taking a drug is, it is easily available, easy or easily accessible, I can say, and it has a lot of stories. So we tend to get influence, and you become a part of it. You want to taste it, you want as a part of experiment, and you become addicted. So there are many chances, or you start following what others are following. You start disbelieving in yourself, and then start doing it. Why I'm trying to focus on these things is that because every case or every person with dependency comes with a very lower self esteem. They come with a background of emotional dependency, emotionally neglected, or rejected, or a history of failure, repeated failure, criticism, loneliness. These are certain things which comes and then gives introduction or entry to substance abuse. So it is very important the way it starts with behavior, a faulty pattern of behavior or a experience, and it also ends with a faulty pattern of behavior. I mean, somebody who's a loner, somebody who's got a history of rejection, somebody who's got life of difficulty also gets into difficulty later on. Though most of the cases people are in denial, they don't understand unless until there is a long-term effect. Clinical conditions where there is it affects their liver, pancreas, may lead to cancer, breathing issues. It is very difficult to convince people because number one, most of the cases, the the theory or the story of substance abuse says that it is taken as a pattern of avoidance to the life situation or the life failures. It is also taken as a lifestyle pattern. It is also taken to show the prominency that I am or I can. So, people who have a lot of poor or lower self esteem, they think and start believing that taking these makes them more prominent and stronger. Now, getting back to the next, yes, the most important part of my presentation today is how can we help? Number one, we must know when to help, how to help, and what to help. Because it is said that recognizing that that you have a problem is the most important stage of any rehabilitation process. Because unless until you recognize that you have a problem, unless until you recognize that this is affecting your lifestyle, you are becoming aggressive, you are unable to talk to people properly or connect with your family, you are affected, it is not easy. So in every recovery phase, as a psychologist, I always see the level of motivation the client has, whether the client has recognized it or it is forceful, whether the client feels that I need to get helped, or I need this, whether the person has introspection or introspected before he or she is visiting the clinic. Why? Because this is one thing I keep on telling all my patients, because if I don't know myself, then it is very difficult for the other person to understand me. How will I explain others if I do not know who I am myself? So introspection is very important. You need to know the blockages, how it started, why it started, what am I gaining, and then coming back to the cure part, or understanding or analyzing the process that actually I'm not gaining, I'm losing. Even if I'm gaining, it is for a shorter period of time, not a longer one. What it is affecting? It is affecting my relationships. It is affecting my behavior. I'm shouting suddenly. It is affecting the way I think. I'm becoming more negative, more critical. It is blocking the way I used to think or my acceptance. It is giving me slow reflexes. It is giving me a lot of mood fluctuations. Sometimes I'm sad, sometimes I'm angry. I feel I'm worthless. I don't see standing anywhere. So these are certain things which we must ask for when if we are going for a rehabilitation process. And then comes the intervention. What to choose? You understand the person, the problem, the substance which has been abused or taken, the level of dependency, the reason behind the dependency. Now the treatment plan, which is also very, very, very important. Why? Because not every patient comes with a similar story. So you need to understand what I need to start off with. There are some people who can control, and trust me, if you can control one day, you can control your lifetime. This is what I keep on telling all my patients, that if you are successful one day, it is for the lifetime. That means you are focusing towards the rehabilitation process, towards the making process, which is easy, or which is more motivating, rewarding. Now, whether it is going to be a drug therapy, whether it is going to be a talk therapy, which means just counseling the person, making that person understand, helping him or her vent out what goes on in their mind, and and of course, when I talk about therapy, because it affects your physical environment as well, so it is important that you start talking about or introducing meditation. Little bit of lifestyle change means you are more indulged into exercises, you are into good balanced diet, you are occupied with some productivity all the time. So you're, because human mind, it asks for stimulations. And unfortunately, people with addiction or people with dependency, they can create stimulation to go. They create channels to have or start taking, the substance. Most important part here again is the family supportive therapy, because these people lack support. So they feel that they are being judged. They feel that they will be criticized. They do not want to face the reality. They do not want to come out of that you know that phase, that the world which they have created, because in that world everything is unconscious, everything is imbalanced. So you are actually in a pseudo world which is not real. So here the support from family, making that person visible, important, cared about, is very, very important. And continuous motivation. Counseling helps. Counseling helps in venting out. It helps in talking out. It helps in finding solutions. Rectifying the criticalities, coming back to the focusing on the positivity and not on the negativity. But family also helps in the physical contact or physical connect. It can hold you emotionally, it can hold you intellectually as well. It can make you feel you are important and you can do it. So we, in our comprehensive plan or the treatment we do, we always look into a greater amount of family support, where they talk about the positives or the challenges the person is taking and how it affects. On a contrary, what we also do is that initially when we start the mental status examinations and make the person feel that, see, because of the long-term use, you are not only affected clinically, but your level of memory, your perception, your thought process, your intellectual abilities have got affected. We allow them to give a retest. We allow them to start examining themselves, introspecting themselves, and see how the curve of abilities, how the curve of concentration, focus increases with a without these substances. So, they start believing that no, it's not the substance, it is me who can make a change. So I think I've tried covering fewer portion of the impact of alcohol. More than, I think, more than the impact, it is very important we know that alcohol has become, or drugs have become very close to us, a very, it is just next to our doorstep. We have to stop, we have to stop allowing them to come to us, because in that case, even if you have the knowledge, knowingly and unknowingly, it will make us all helpless. And by the time we think or we'll realize, it will be too late. So I think with the help of this presentation, I've tried making you understand you also have a cell phone inside your brain, and which is working fine. But if you start pouring in external substances, it may become very heavy, and the process it is doing their work, the speed it is taking over now, it may slow down. And if it slows down, then the whole way, the way we are functioning, it will get affected, and we all will, get into difficulties. So I think that's the end of my slides, and I would like to, conclude. As I said, recovery is hard, regret is harder. So we have to decide whether you want to recover or you want to regret. I think best conclusion would be, let's become aware, let's become conscious. When you are conscious, your brain is conscious, and vice versa. So when you have to celebrate, there are other things through which we can celebrate. If you have to focus, there are other things through which we can focus. We need not get into something which may affect us in a larger way, in a more difficult way, in a longer. Thank you so much. I think now we should be open to questions. Am I right, Anne?
Yes, ma'am. Thank you so much for the wonderful session. Though it was not a face-to-face interaction, I really felt into the presentation. I hope our viewers also enjoyed it. So, ma'am, let's move on to the questions. We have few questions here. I'll be telling you the questions.
Okay.
So one of them I've asked, Kirtana N. She has asked, effect of prenatal exposure to drug and alcohol on the brain. What are the effects of prenatal exposure to drug and alcohol abuse on the brain?
See, as I already discussed in one of my slides, it's not about, see, what happens when you eat more in whatever stage of your life. If you eat more and if you eat irregularly, it is going to affect your body weight, right? It is going to affect your metabolism, your BMI. Similarly, whether it is the prenatal stage, postnatal stage, these substances have the capacity of, slowing down the whole process. So at any stage of time, there is no stage which is a, safer stage, or there is no stage which is a easier stage. But yes, since in the prenatal stage you are more vulnerable to, difficulties, or you can have more, you get more prone to infections or any kind of disease. This is something which you must understand. This is a very sensitive stage, and it not only can affect you, it can affect the fetus as well. So that we need to understand. I mean, that's why I think doctors definitely recommend that during the prenatal stage, you are not supposed to get into any alcohol or drug, because it may affect, because that's a building up time, you see. So the way you nurture, you are going to become like that, and your child is going to become, your fetus is going to become like that. So I think very important that, if you really want to have some fun, have some sharbat and gozas, and and enjoy that. That would be better. Yeah.
Okay, so the next question is by Shreya Mohapatra. So in the
Yeah.
case of cannabis, there is growing evidence of the use of CBD oils, that is cannabis oils, for pain management, anxiety management, and such useful effects. So, will it cause dependency without the THC present in it? So, that is what her question is. So, it is used for a treatment. So, is it going to be somehow be a dependency as well?
See, I think we need to here understand what is use and what is abuse. Ms. Mahapatra, this is for you. You are using it as a medication. When it becomes abusive, it will affect you adversely. Remember that. So, abusive means there is an imbalance. You are taking it the way you should not take it, or you are taking the darker part of it, you are taking the negative elements of it. Any drug which is used, I mean, most of the drugs actually are used in medications. So we take the better part of it and put it for your treatment. So it becomes usable. The other part of it, which is not usable, is abusive. So you need to understand that. Secondly, anything which goes beyond your limit. Unfortunately, these substances are very addictive in nature. You take once, you want to take more, you want to take more, more, and more. So there is no diminishing marginal utility which works with substance abuse. And for that reason, the use and abuse, the parameter goes up suddenly and you will not be able to control. So that you need to understand. Whether you are taking it as a remedial drug or you are taking it because you think it helps you otherwise. Why are you using it? That's also very important. Because there are substances like iodex, there are substances like Vicks and all. People also take it. It has nothing to do with your health or something, but they have a belief system that this gives them a feeling of pleasure, so they start taking it. So the need and the reason for which you want to use it is something which is very important.
I hope her question is answered. We have a next question. How reversible are the effects from such abuses, especially structural effects on the brain? How reversible are the effects?
See, definitely, because on the first slide itself, I say, it shrinks. So if you start putting more and more and more and more, what will happen? The way your brain is functioning, it will not function, right? The way it should make you understand the basic abilities. See, brain is this, but the branches are like this, right? The functions are like this. It does multiple roles for us. So on a long term basis, if you start taking, it affects the structural parameter, you know, the structure of the brain. So of course, when the structure of the brain is affected, the functions are affected as well. And every function is related to your mind and body both. So of course, I somehow I cannot really stand for the drug and alcohol abuse for the fact that the way we have seen cases, it is very difficult to come out of dependency. Trust me. So whether it is because it changes the belief system of that person. It changes the concepts, the basic concepts. So you start focusing on what you want to focus. You start forgetting about your own, the environment around. You start thinking about what you're thinking is right. So long-term effects are very, very dangerous, definitely.
Okay, so the next question, I hope it's last. Why are teenagers more susceptible to substance abuse? And are there any psychological disorders that cause drug abuse? I mean, that is what the question is. So,
Yeah,
why
yeah.
are the teenagers more susceptible?
So the first question is why are the teenagers more prone to drug abuse? Uh, I would put it to the lifestyle. Number one. Nowadays, when you go visit somebody or in the weekends, everybody parties and there is definitely booze. They booze, right? There's definitely alcohol. There's no party which happens in our country now without alcohol. So the impact of lifestyle has affected them, number one. Number two, a teenager is always very, very vulnerable to understand, and they struggle with success and failure. They struggle with their self expectation and expectation of their parents, expectation of their peer. They are stressed with the career. So, whatever. So, they have a conflicting mind. What happens with a conflicting mind? You start believing whatever is easier for me, I will do. So they start following others. Most of the cases, they one of their friends have gone into a kind of a drug abuse, and he gets highest rank in an examination, and that becomes a tradition. They think so. They start correlating. Secondly, so as I said, there is always an emotional background of any drug abuse or any alcoholic history. So that needs to be settled first. And of course, they believe in myths. There's also a prophecy of helocentrism. Everybody can take, I can take. Teenage is a time when you want to become a hero. The psychosocial needs become very high. The need for affiliation, need for approval becomes very high. So you start taking challenges. Unfortunately, the challenges are related to alcohol or drug because others are doing it. And yes, most often alcohol or drug has been related to many psychological or mental disorders. Why? Because it starts regulating your emotions. It starts regulating your belief system, your thought processes. Long term, you start hallucinating. Okay, so we call it, substance abuse disorder, wherein there are symptoms of mental ill health or mental imbalances. Not necessarily that every person with a mental health issue will have a history of alcoholism or drug abuse, but yes, with you know a longer duration of intake of drug or alcohol may make you fall into a mental disorder issue. Yeah.
I think we go for the last question now. Kirtana is asking, are there any pharmacological interventions for recovery from the addiction of alcohol and drugs? Pharmacological interventions.
Yes, 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 absolutely. Actually, if you talk about the traditional method, it was always the pharmacological interventions only. Slowly, because I said they started believing, and the researchers have proved that every kind of substance abuse or every kind of alcohol abuse is related to some kind of a emotional history, some kind of a rejection, some kind of a psychological history. So now the pattern is divided into two parts. One is the physiological, which is absolutely pharmacological. Medicines are given. There is a pattern of taking medicines which helps you come out of it, which helps you withdraw these things, that is injected or that is prescribed, so that you start avoiding. The moment you start taking it, it may make you get into, make you feel vomiting or very awkward, unhealthy, uneasy, so you start avoiding it. Secondly, so one is the healer. One starts uh, healing your physiology through pharmacology. The second part is the psychological intervention, wherein there is a process of psychotherapy or talk therapy, family supported therapy, occupation. There is exercises and yoga, which helps you calm down, which helps your brain relax. So you can handle your urge, you can handle your withdrawal symptoms, you can handle the anxiety, the withdrawal symptoms. So that is a second pattern. But yes, pharmacological interventions are majorly the, I think 50%, 50% of the rehabilitation process is dependent on the pharmacological interventions only.
Thank you, ma'am. I think we'll wrap it up. Thank you so much
Thank
for
you
this
so much.
wonderful session. I'm
Thank you
sure
so much.
all our viewers are very much happy about the information that you have given. So we wrapping it up. We also have a lot of case studies and brain trivia competitions. So you guys can check out the website. And the next session will be at 9. So see you all then. Thank you. Thank you so
Thank you
much.
so much. Thank you so much.